Have you ever knelt down on the kitchen floor with a toothbrush in one hand and your dog in the other, only to end up wrestling on the tile while they clamp their jaw shut, paw at your wrist, and look at you like you've betrayed them? Both of you breathing hard, both of you done. And the toothbrush, somehow, still completely clean. If that's you, I want you to know something right now. You are not failing. Brushing a dog's teeth is genuinely one of the hardest things we ask pet parents to do. So what if I told you that you don't have to win that wrestling match every single night to give your dog a cleaner, healthier mouth? What if the thing that actually moves the needle on Plaque and Tartar is sitting in your kitchen right now, something you pour, sprinkle, or stir into the bowl they already eat from twice a day? Let me guess what you're thinking. Come on, Dr. Mei. Add something to the bowl and the tartar just disappears? Really? I get it. I'd roll my eyes too. So let me be straight with you from the very first minute, because that honesty is the whole point of this channel. There is no magic powder that melts off hardened brown tartar overnight. Anyone selling you that is lying. But as a veterinarian, I can tell you, there are real, science-backed things you can add to that bowl, that slow new plaque down, soften the daily film before it ever turns to stone, and over time genuinely change what's happening in your dog's mouth. And here's why this matters more than almost anything else you'll do for them. By the time they turn 3, around 80% of dogs already have active dental disease. Not bad breath, disease. Hi everyone, I'm Dr. Mei Chen, your neighborhood vet. Quick honest note before we go one step further. I'm a veterinarian sharing general information to help you care for your dog. But I'm not your dog's vet, and nothing today is a diagnosis. Every animal is different. And because everything in this video goes into your dog's mouth, introduce it slowly, watch for any reaction, and check with your own vet first if your dog is on medication, very young, very old, pregnant, or has a health condition. That's it. That's the whole disclaimer. Now, if you've never been able to get a toothbrush near your dog, drop the guilt at the door. You are not a bad pet parent. You're a busy human with a strong-willed animal, and you're here learning, which is exactly what a good pet parent does. So grab a notebook, hit subscribe to join our little pet parent community, and let's get into it. But first, you have to understand one thing. Because if you miss this, none of the rest will make sense. Here's what most pet parents get wrong. They think tartar is the problem. Tartar is just the gravestone. The real story is plaque, that soft, almost invisible film of bacteria that builds up on the teeth within hours of eating. Run your tongue over your own teeth at the end of a long day. That slightly fuzzy feeling is plaque. Now here's the part that changes everything. In a dog's mouth, that soft plaque begins to harden into cement-like tartar in as little as 24 to 48 hours. 48 hours, that's the window. Once it mineralizes into tartar, no bowl additive on earth will scrub it off. That's a job for your vet. But everything we do today targets that 4-8 hour window. We work on the plaque while it's still soft, before it ever becomes the brown stuff. Disrupt the film, slow the buildup, and your dog's teeth stay healthier between cleanings. That's the real game. And here's the thing nobody tells you about that. You already have a warning system, and you use it every day without realizing it. It's your nose. That sharp, almost fishy, slightly rotten smell when your dog yawns in your face or rests their chin on your knee. That is not just dog breath. Healthy gums don't smell like that. That odor is the smell of bacteria and infection, and it is the single earliest sign that something is going wrong in there long before you ever see a brown tooth. So if you've been wrinkling your nose and thinking it's normal, it isn't. And that's actually good news, because it means you caught it early. And it's not just about pretty teeth or fresher breath, though you'll get both. The gums are wrapped in tiny blood vessels. When the gums are inflamed and infected, That bacteria doesn't politely stay in the mouth, it slips into the bloodstream and gets carried straight to the heart, the liver, and the kidneys. We see the link in practice all the time. A clean mouth isn't vanity. It's one of the cheapest, quietest ways to protect the organs that keep your best friend alive. I think about the comments I read all the time, people who remember a childhood dog that ate table scraps and lived to 14, and they wonder what changed. Some of it is exactly this. We made everything softer, more processed, more expensive, and somewhere along the way, the simple stuff got forgotten. So when I say the bowl is the cheapest medicine cabinet you own, I mean it literally. Okay, let's get into what actually works. Notebook ready. Number 1. The single most effective bowl additive, and the one most people have never heard of, is a VOHC-approved dental water additive. Picture this. You fill the water bowl every morning. You pour in a small capful of an unflavored additive. Your dog drinks throughout the day like always, and the active ingredients go to work on the plaque every single time they take a sip. No wrestling, no toothbrush, just their normal water. Now, VOHC stands for the Veterinary Oral Health Council. It's an independent body that reviews products and awards a seal only to the ones that actually proved in trials that they reduce plaque or tartar. So you're not trusting a marketing claim on the bottle, you're trusting the data behind a seal. Look for the VOHC accepted seal, that's your shortcut through a shelf full of hype. It runs you roughly $15 to $20 for a bottle that lasts weeks, which is pennies a day. The caveat, and I want you to hear it, follow the dilution on the label exactly. Don't pour it into food. And if your dog is a fussy drinker who refuses the water, stop and try the next option instead. A dog that won't drink is a bigger problem than a little plaque. Now, let me be honest with you, because I promised I would. This is the moment I have to say it out loud. None of these are a replacement for brushing. Brushing is still the gold standard. Full stop. If your dog tolerates a toothbrush, please brush. These bowl tricks are for the other 80% of us, the ones living in the real world with a dog that turns into an alligator the second a toothbrush appears. They reduce buildup. They buy you time. They do not replace a real cleaning when your vet says your dog needs one. I'd rather you trust me with that truth than oversell you a powder. Here's where this knowledge comes from, by the way. There was an old farmer down the road from where I worked. Everybody just called him Old Earl Sanborn, and his working dogs had the cleanest teeth I have ever seen on a dog, gleaming white into their old age, and he'd never brushed a tooth in his life. His secret wasn't a secret at all. Those dogs spent their days gnawing on tough, raw, fibrous stuff out in that yard, and the chewing did what a toothbrush does. Old Earl used to lean on the fence and say, "Doc, a dog's teeth stay sharp the way a knife does by being used." I've never forgotten it. Half of what I'm giving you today, that man showed me first, without a single textbook. Take a breath, because number 2 is the one most people get backwards: seaweed. Specifically, a dried brown seaweed called Ascophyllum nodosum. It's the active ingredient in a lot of those plaque powders you sprinkle on food. Here's the plain English science. Compounds in this particular kelp travel through the bloodstream to the saliva, and they appear to make the plaque looser and easier to wipe away, so it builds up more slowly, and the tartar that does form is softer. There's actual research behind this one, which is why I'm comfortable naming it. You buy it as a fine powder, you measure a small dose by your dog's weight, and please follow the package dosing exactly, because more is not better, and you stir it into one meal a day. A tub is around $15 to $25 and lasts a couple of months. The honest caveat, it's slow. You won't see anything in 24 hours. You're looking at weeks before the next round of plaque comes off easier. And skip it if your dog has a thyroid condition, because seaweed carries iodine. That's a real conversation for your own vet first. Number 3. And this one, I have to tell you the unglamorous truth about coconut oil. You have seen 100 videos swearing that a spoonful of coconut oil in the bowl whitens teeth, kills bacteria, and cures everything short of a broken leg. Let me be the vet who actually levels with you. Coconut oil is overhyped. The dental benefit is thin at best, the evidence in dogs is weak, and that spoonful is pure fat in a small dog. Daily coconut oil can mean weight gain or even trigger a painful pancreas inflammation. I'm not telling you it's poison. I'm telling you it's not the dental miracle the internet sold you, and there are better, cheaper, safer things in this very list. So save your coconut oil for the occasional treat if your dog loves it, and don't count on it for teeth. That's me keeping my promise to you. Number 4 is my favorite, because it costs almost nothing, and it's already in your fridge. Crunch, texture, the mechanical scrub of a dog actually chewing something firm. In the wild, a dog's ancestors didn't eat soft mush, they tore through tough, fibrous prey, and all that gnawing kept their teeth scraped clean. Modern kibble pretends to do this, but most kibble shatters into powder the instant it's bitten and does almost nothing for the back teeth. So give them real crunch. Raw carrot sticks, a big firm one, your dog has to actually work on. Crisp slices of cucumber. A piece of raw, crunchy apple with the seeds and core removed, because apple seeds aren't good for them. As your dog gnaws, the firm surface drags along the side of each tooth and physically wipes away that soft daily film. A little edible toothbrush they're happy to use, because to them it's a treat, not a chore. They're basically free. The caveats matter, so write them down. Cut them to a safe size so there's no choking, especially for small dogs and enthusiastic gulpers. Introduce any new vegetable slowly so you don't upset the stomach. And remember, these are low-calorie extras, not a meal. And one method I will refuse to recommend, because I've seen what it does. Please do not hand your dog a cooked bone for the crunch. Cooked bones splinter into sharp shards that can pierce the gut, and that is an emergency surgery, not a dental tip. A raw carrot does the job and can't hurt them. So a carrot a day instead of a processed dental stick? Your dog's teeth and your wallet both win. Now, before number 5, the simplest one of all, and the one nobody talks about because nobody can sell it to you, plain, clean, fresh water in a clean bowl. I know, it sounds too basic to matter, but a slimy water bowl is a bacteria farm, and that biofilm goes right back into the mouth your dog just drank from. Wash the bowl with hot soapy water every single day, and here's the small upgrade. Switch from a plastic bowl to stainless steel or ceramic. Plastic scratches, and those microscopic scratches hold on to bacteria no amount of rinsing fully clears. A steel bowl is a few dollars, it lasts forever, and it stops reseeding your dog's mouth with the very bacteria you're working to control. Cheapest tip in the whole video, maybe the most ignored. And number 6 is for the part of all of this you can actually smell the breath. Curly parsley. Fresh, finely chopped curly parsley, just a pinch stirred into the food, is a gentle, natural breath freshener with a little antibacterial action. But listen very closely, because this is the most important sentence in this entire video. It must be curly parsley, not spring parsley. Spring parsley is a completely different plant, and it is toxic to dogs. It can cause real harm. They can look similar at a glance, and that's exactly how people get hurt. So when you're at the store, you say it out loud, curly parsley. A small bunch is about $1, a pinch goes on the food, and you're done. If you can't tell the two apart with total confidence, just skip it. There are 5 other things on this list, and no breath tip is worth a risk to your dog. Let me pull this together, because I can feel some of you doing the math on what a dental solution usually costs. Here's the world we're living in. Private equity has been quietly buying up veterinary clinics for years, and the prices climb every single year. A professional dental cleaning under anesthesia can easily run you $300, $400, $500 or more. And I am not telling you to skip that cleaning when your dog truly needs one. Sometimes anesthesia and a real scale and polish is exactly the right call, and your own good vet is the one to make it. That's not the enemy here. The enemy is the upsell, the idea that the only thing standing between your dog and rotten teeth is a constant stream of expensive products and procedures. Because the truth is, a VOHC water additive, a seaweed powder, a daily carrot, a clean steel bowl, and a pinch of the right parsley, that's a few dollars a week. And done consistently in that 4-8 hour plaque window, it can stretch the time between cleanings, soften what does build up, and protect the heart, liver, and kidneys downstream. Nobody makes a fortune telling you the fix is a carrot and a clean bowl, so they don't tell you. I just did. Before I let you go next time, I'm going to show you the $3 add-in that calms an itchy, paw-licking, yeasty dog from the inside out. It's the natural next step after today. And once you see the connection between the gut and the skin, you won't be able to unsee it. So make sure you're subscribed so it lands in your feed. Remember, you don't have to be the perfect pet parent. You never did. You just have to care enough to learn. And you so clearly do. You watch this whole thing for a dog who will never even know you did it. Give your best friend a scratch behind the ears for me tonight. Because the best medicine was never the most expensive. It's the love you already give them every single day. I'm Dr. Mei Chen. I'll see you next time.